Polish Cardiac Society celebrate 60th anniversary of our society this year.
Polish Cardiac Society was created in 1954 as the idea of Professor Mściwoj Semrau-Siemianowski. The next very important dates in history of Polish Cardiac Society are 1956, when Polish Cardiac Society was admitted to European Society of Cardiology, and 1957, when the first Polish journal, cardiac journal, was published, Kardiologia Polska, Polish Heart Journal, under two first editors-in-chiefs, Professor Jerzy Jakubowski and Professor Ryszard Feniksen. We can say in Polish cardiology that we have four founding fathers. As Americans have founding fathers of USA in Mount Rushmore, we have our Polish cardiac, Mount Rushmore, and these are four very important professors. I mean, Professor Mściwoj Semrau-Siemianowski and his three pupils, three first presidents of Polish Cardiac Society, Professor Jerzy Muszkaten-Blit-Jakubowski, Professor Edward Żera, and Professor Zdzisław Askanas.
Polish Cardiac Society is one of the largest and one of the most active medical society in Poland. Our major aims are mainly education based on the promotion and implementation of current European guidelines in cardiology, and also what we do is organization and accreditation of training in cardiology also based on European recommendation. And what is, in my opinion, very important, we strongly support high-level cardiovascular research.
Educational platform of the Polish Cardiac Society exists already for 2 years. We prepared 6 courses, that means that is more than 70 lessons done by more than 80 experts. This is the education of the highest professional level. Last course about electrocardiography is a unique interactive course. We have also the very special way to present the guidelines, that means that are interactive guidelines, but also the simulators for the clinical decision making. On the platform you can find some information about the congresses, but also some lectures from them and actuality from whole the world. Right now we are preparing the part for the patients and their family. Until now, more than 2,000 of Polish cardiologists been active on the educational platform of the Polish Cardiac Society. I think that it is a very good field for the cooperation with the European Society of Cardiology.
During the last 15 years, we have seen a great progress in cardiology in Poland. There is a steady increase in the numbers of coronary angiographies, PCI, ICD, and ablation procedures. We have a better access to modern diagnostics and therapy. Almost 90% of patients with ST elevation MI are treated by primary PCI, placing Poland in the top 5 countries of the European Union. We have introduced a dedicated national program for prevention and treatment of cardiovascular diseases called POLCARD. In the last 8 years, we have doubled the number of cardiologists and young fellows in training. I'm very proud to be a part of such a creative and forward-moving community.
Invasive cardiology is the youngest child of Polish cardiology. However, it is developing really very fast. We can say that in recent years, Polish invasive cardiology was trying to help people with STEMI and acute coronary syndromes. And we can say we achieved a great success, and now this treatment, invasive treatment, is available everywhere in Poland in more than 150 cath labs, working all day long and all week long. Now we have new goals. Now we are trying to help people with heart failure, and I think we are trying to do it through all these valve procedures like TAVI, MitraClip, and any other devices which will be shown on this congress. We are now, as an Association of Cardiovascular Interventions, having 850 really very good specialists in cardiology.
Polish cardiac surgery has developed rapidly over recent several years, from a few departments in big cities to 38 departments nowadays in the whole country. We have 80 operative theaters and over 1,000 in-hospital beds. There are over 250 specialists in cardiac surgery in Poland. In the year 2013, there were 27,000 open heart procedures in Poland. However, the total number of procedures per 1 million population is still below EC average. Surgical results are in fact not different from those reported by rich European countries. We should be particularly proud of the results of surgical treatment of congenital heart diseases in Poland. Thanks to rapid development of invasive cardiology, we can notice sudden drop in MI mortality. On the other hand, we have more and more patients with heart failure. Our typical patient nowadays is an old patient with aortic stenosis and coronary heart disease. Such a patient requires prolonged intensive care and very early rehabilitation.
Echocardiography is used as a first-line imaging tool for many years and nowadays became widely accepted not only by cardiologists but also by cardiac surgeons, interventionists and anesthesiologists. Currently, there are more than 1,000 physicians in Poland who are members of the working group on echocardiography of Polish Cardiac Society, which was set up roughly 25 years ago. From the very beginning, one of the main tasks of the organization was and still is education. And this is also of particular importance nowadays because of rapid development of new ultrasonic technologies, tissue Doppler imaging, strain rate imaging, and three-dimensional echocardiography. All these technologies are increasingly often used by Polish echocardiographers, both for clinical and scientific purposes. Whereas TDI and strain rain imaging are frequently used, 3D echocardiography, particularly transesophageal one, is utilized mainly in academic and main scientific centers where reconstructive cardiac surgery and advanced percutaneous procedures such as TAVI or mitral valve repair are performed. Summarizing, Polish cardiologists are very keen to implementing new ultrasonic technologies into clinical practice according to current European recommendations. Also, a lot of scientific projects utilizing new echo technologies are currently going on in Poland. Therefore, I am convinced that strong position of Polish echocardiography in Europe will be retained within the coming years.
Children with cardiac problems in Poland have an easy access to modern pediatric cardiology and cardiac surgery, starting with a fetal age. Modern diagnostic tools that we have available here as echocardiography, computed tomography and magnetic resonance are the good base for decision making in this complicated patients with congenital heart diseases, with arrhythmias, with pulmonary hypertension and also different problems. Annually in Poland, 2,600 of surgical procedures, 1,600 of percutaneous procedures and more than 100 of ablations are performed in children. Here in Children's Memorial Heart Institute in Poland, in Warsaw, we are in this center, which is one of the 10, the most active one in this field.
Transcatheter aortic valve implantation is a new method of implantation of bioprosthesis in older patients with severe aortic stenosis who are not optimal candidate for surgical valve replacement. First TAVI was performed by Dr. Alain Cribier in 2002 in France. After this, big randomized trials comparing TAVI with surgical aortic valve replacement confirmed high efficacy and safety of this new procedure. In Poland, first TAVI procedure were performed in Krakow and Zabrze in 2008, shortly followed by centers located in Warsaw, Katowice, Poznań, Gdańsk and Wrocław. Today in Poland we have 20 centers which perform TAVI, and in 2013 381 procedures were done in Poland. I have to stress that it is much too less in comparison to needs and expectation of the patients with severe aortic stenosis who are not optimal candidates for surgery. Nevertheless, nowadays transcatheter aortic valve implantation are also offered to patients with intermediate surgical risk with very good results. Simultaneously, new TAVI bioprostheses are available, which are more operator-friendly and, what is even more important, offer better procedural results.
During the last 60 years, the world has changed, but also cardiac rehabilitation has changed. Cardiovascular prevention became the most important area of scientific activities in cardiac societies. An important milestone and also the success of the Polish School of Cardiac Rehabilitation was achieved by the adoption of the World Health Organization, the concept of rehabilitation developed by Polish researchers, Professor Zdzisław Askanas and Professor Stanisław Rudnicki in the 70s of the last century. Nowadays, our overriding objective is exercise therapy and education, striving for a sustainable, beneficial lifestyle changes that the patient will continue after completion of his rehabilitation program. Not only we improve patients' prognosis and extend their lives, but we also attach a great importance to its quality. We are lowering the costs of treatment and reduce the risk of readmission. Our present important challenges are the rehabilitation of patients with comorbidities, with heart failure on ventricular assist devices, grown-up patients with congenital heart defects and pulmonary hypertension, new methods of cardiovascular surgery, and patients getting older. At the next anniversary, I would like to announce that people no longer smoke cigarettes. Educated by us, young people had escaped cardiovascular diseases, and those who didn't took advantage of an early, comprehensive, continuous, and universal cardiac rehabilitation.
Less than 20% of patients who should be rehabilitated participate in cardiac rehabilitation program. How to improve this situation? The answer is home telerehabilitation. It is why in the Polish Cardiac Society optimal model of cardiac rehabilitation, the novel hybrid option was included. Patient, before beginning a training, informs the monitoring center about the present condition, fatigue, medications taken, and transmit resting ECG, blood pressure, and weight. If there are no contraindications, patients may start exercise training. Patients follow the exercise program led by blip and light signals. ECG is registered automatically during the training sessions. All data are analyzed by consultant, and the safety, efficacy, and accuracy of rehabilitation program are assessed. The results of our experience have been published. This year we will start a multi-center study, TeleRef-HF. We believed that the results of this study will be the basis of the introduction of home-based telerehabilitation in the European standards.
Until 2003, only limited data were available on the incidence and treatment of acute coronary syndromes in Poland. Therefore, we established a nationwide PLACS registry coordinated by the Silesian Center for Heart Diseases in Zabrze in cooperation with the Ministry of Health and the National Health Fund. Over 10 years, we have created one of the largest data sets in Europe with detailed information not only about the initial hospitalization and procedures, but also about events after discharge for more than 550,000 patients with acute coronary syndromes. In nearly 40 peer-reviewed publications and nearly 100 conference proceedings, we reported and highlighted the immense progress which has been made in our country in the quality of treatment thanks to increased availability of reperfusion and revascularization therapy for AMI. In fact, over the years, the proportion of patients treated invasively doubled, and similar increase in the number of primary PCI procedures was observed. It resulted in a significant improvement of prognosis and reduction of mortality in patients presenting with ACS. As a PLACS team, we are also proud that one of our papers on invasive treatment of ST segment elevation MI after 12 hours from the onset of pain influenced directly the European guidelines on STEMI. The registry was also a source of data for government institutions and the European Society of Cardiology. Recently presented results of a nationwide database on acute myocardial infarction, AMI-PL, based on all Polish patients with myocardial infarction, is the perfect complement to the registry for assessment of epidemiological indicators. AMI-PL has shown similar treatments and outcomes of rural and urban area AMI patients in our country. This is a big success of Polish cardiology. We believe that continuous monitoring, both with PLACS and AMI-PL, is essential to verify the health system performance.
ZATPOL2 is a continuation of the registry which was dedicated to diagnostic strategies in pulmonary embolism. Now we'll be focusing on therapeutic strategies, and at the same time we'll be trying to identify patients that continue to suffer from dyspnea and who develop chronic thromboembolic pulmonary hypertension after an acute episode. We hope that using the platform of Polish Cardiac Society congresses and symposia, we'll be also able to deliver the new knowledge and particularly the messages conveyed by the new ESC guidelines on pulmonary embolism, which are presented at the Congress this year.
I would like to present the preliminary results of a recovery registry, which we run in the Institute of Cardiology in Warsaw, and it is Polish Cardiac Society initiated grant. It is done in 9 centers all over Poland, and we have included over 250 patients in the registry. And what is striking at the very beginning is that patients that are treated with ablation have a lower mortality rate than patients treated in intensive care units. It's 9% versus 25%, so the difference is huge, it's statistically significant, although we have not included all the patients that are planned in the registry. The other thing that is shown in this registry is that there are some factors that might predict death in patients with electrical storm. That is previous cardiosurgery, valvular heart disease, heart failure, or older age of the patient. So I hope that after we finish the registry, we might create a scale that would predict whether the patient hospitalized with an electrical storm is in high risk or low risk group. And I hope that we could implement the results of this registry into healthcare organizations in Poland and worldwide.
Recently published surveys suggest that secondary prevention has been improved in Poland during the last 20 years. However, the improvement could be even greater. Moreover, about 20%, only 20% of all acute coronary syndrome patients take part in cardiac rehabilitation following hospitalization. This is why the experts of Polish Cardiac Society described the optimal model of comprehensive rehabilitation and secondary prevention. The experts insist that all patients undergoing cardiac surgery or those hospitalized due to heart failure or acute coronary syndrome should take part in secondary prevention and cardiac rehabilitation programs following hospitalization. Moreover, the experts suggest quality assurance, which could consist of risk factors measurements about 6 months after the end of a cardiac rehabilitation program. The quality assurance could help cardiac rehabilitation centers to assess the quality of their service. The experts of Polish Cardiac Society estimated that wide implementation of the optimal model could be related to the decrease in number of deaths by over 3,000, to the decrease in number of myocardial infarctions by over 4,000, and to the decrease in number of heart failure hospitalizations by over 8,000 yearly.
This year we are celebrating the 20th anniversary of the establishment of the Club 30, the unique section of Polish Cardiac Society. Professor Ceremurzyński was the founder, the charismatic mentor, and first of all, the great friend of the Club 30. The major aim of the club was to integrate young cardiologists and to facilitate scientific collaboration. Currently, there are 186 club members, and among them, there are 40 persons with the title of Professor of Medicine. The scientific output of all club members can be counted in thousands of impact factors. There is no doubt that young cardiologists from other European countries could take advantage of the 20-year history of the Club 30. It's extremely encouraging that at the moment many young cardiologists who join the club are the followers or younger co-workers of the older club members. Professor Ceremorzyński described himself, his initiative, as an experiment. And if you would like to find out whether this experiment was really successful, I would like to encourage you to read our Jubilee monograph. And if you are planning to attend the Congress of Polish Cardiac Society in Poznań in September, you are more than welcome to participate in our Jubilee session.